If you've been dealing with symptoms you think might be perimenopause, but you're not sure how to talk to your doctor about it or you're worried they won't take you seriously, this video is for you. Hi, I'm Dr. Megan Tierney. I'm board certified in family and obesity medicine and a Menopause Society certified practitioner. And I'm the founder of Sorrel Health and Wellness in Seattle, Washington. Today, we're talking about how perimenopause is actually diagnosed, what information your doctor needs, and how to prepare for your appointment so you can finally get the help you deserve. Before we dive in, hit subscribe if you want more evidence based midlife health content. And if this helps you, share it with a friend who has been struggling to get answers because knowledge is power, especially when it comes to advocating for your own health. Let's start with the most important thing. There is no single test that definitively diagnoses perimenopause. I know that might be frustrating to hear, but here's why. Perimenopause is a clinical diagnosis. That means it's based on your age, your menstrual pattern, and your symptoms, not a blood test. Your hormone levels, estrogen, progesterone, FSH, fluctuate wildly during perimenopause. It could be high one week, low the next, and totally normal the week after that. So, a single blood test is pretty much useless for diagnosis. In fact, clinical guidelines specifically say that hormone testing is not recommended for diagnosing perimenopause in women over 40. The only exceptions are if your doctor suspects premature menopause, meaning you're under 40, or if there are other medical reasons to check your hormone levels. So, if your doctor orders an FSH or estradiol test and tells you your levels are normal, you're not in perimenopause, that's not accurate. Your symptoms and your menstrual history matter more than a single lab value. So, what does your doctor actually need to diagnose perimenopause? Three main things: your age, your menstrual history, and your symptoms. Let's break each of those down. First, age. Most women enter perimenopause between the ages of 40 and 55, with the average being around 47 to 48 years old. But it can start earlier, even in your mid to late 30s. If you're in your 40s and experiencing symptoms, perimenopause should absolutely be on the table. And if you're younger, say 37 or 38, and having symptoms, don't let anyone dismiss you just because you're too young. These definitely warrant further investigation. Second is menstrual history. This is the most reliable marker of perimenopause. Changes in your menstrual cycle are a sign that something is shifting hormonally. What kind of changes? Things like cycles that vary by 7 days or more than your usual pattern, skipped periods, periods that are closer together or farther apart than they used to be, changes in flow, heavier, lighter, or just different, amenorrhea, which is no periods for 3 to 11 months. If your cycles have been regular your whole life and suddenly they're all over the place, that's a huge clue. Third is your symptoms. The most specific symptoms for perimenopause are vasomotor symptoms. That's the medical term for hot flashes and night sweats. These are caused by those erratic hormone fluctuations affecting your body's temperature regulation. Other common symptoms include urinary symptoms like vaginal dryness, discomfort during sex, urinary urgency or frequency, and even frequent UTIs. Sleep disturbances, waking up at 2 or 3 a.m., even without night sweats. Mood changes like anxiety, irritability, sadness, or feeling emotionally raw. Brain fog or trouble concentrating, changes in libido, joint aches and muscle tension, headaches or migraines, heart palpitations, and changes in body composition. These symptoms are common, but they're less specific, meaning they could be caused by other things too. That's why your doctor should also consider other conditions and possibly order labs to rule those out. So here's the bottom line. If you're over 40 and your periods are irregular and you're having vasomotor symptoms like hot flashes and night sweats, you're most likely in perimenopause. No blood test required. Now let's talk about how to have a productive conversation with your healthcare provider. So here's what you bring to your appointment: your menstrual history. Try to track your periods for 2 to 3 months before your visit. Note when your period starts and stops, how heavy or light the flow is, how many days between the cycles, and any spotting or irregularity. You can use a period tracking app, a paper calendar, or just notes in your phone. The important thing is to have specific information rather than relying on memory. And we want a detailed symptom list. Write everything down, even if it feels minor or you're not sure it's related. Include what symptoms you're experiencing, how often they happen, how severe they are, when they started, and how they've changed over time. You don't have to edit yourself or minimize what you're going through. Your doctor needs to know the full picture. We want to know how your symptoms affect your daily life. Be specific about how these symptoms are impacting your work, your relationships, your sleep, your mental health, and your quality of life. We also need your health history. This includes any chronic health conditions you have, all medications and supplements you're taking, family history, especially early menopause, thyroid disease, or autoimmune conditions, previous pregnancies, postpartum mental health issues, or history of depression or anxiety, and your smoking history. All of this context helps your doctor understand your full picture, make sure there isn't a different reason for your symptoms, and helps guide treatment options. We also need to know what you've already tried. If you've made lifestyle changes, tried supplements, adjusted your diet, or done anything else to manage symptoms, mention it. It helps your doctor understand what has or hasn't worked for you. So, what should your doctor do once they have all of this information? They should listen. Take your symptoms seriously. If you feel dismissed or like your concerns are being minimized, that's a red flag. They should rule out other conditions that can mimic perimenopause symptoms like thyroid disorders, anemia, vitamin deficiencies, or mood disorders. They should discuss treatment options, including hormone therapy, non hormonal medications, lifestyle modifications, and other therapies tailored to your specific symptoms. They may order hormone labs if appropriate, but remember, your symptoms and story matter more than a single number. Labs are most useful if there's a question about premature menopause or if your symptoms haven't improved with appropriate treatment or you have other medical conditions that can make it confusing. And they should also have a follow up plan. Perimenopause is a transition that takes years, and your symptoms will change and you will need regular check ins. And here's the hard truth: not every healthcare provider is well trained in menopause care. If your doctor brushes you off and tells you it's just stress or you're too young or refuses to discuss treatment options, you're allowed to get a second opinion. You deserve a provider who takes you seriously, listens without judgment, stays up to date on current guidelines, offers evidence based treatment options, and sees you as a partner in your own care. If you're struggling to find that kind of provider, look for someone who is a certified provider through the Menopause Society. I'll leave a link in the caption. Let me leave you with this: perimenopause is real, your symptoms are real, and you don't just have to just tough it out. You know your body better than anyone else. If something feels off, trust yourself and keep advocating until you get the care you deserve. If this video is helpful, please like and subscribe and share it with someone who needs to hear this. Thanks for watching, and I'll see you next time.